Great. Hi, everyone. Good afternoon. Thank you so much for joining us. My name is Samantha Kubek, and I am a visiting assistant clinical law professor at Hofstra Law School, where I am the director of the Robert W. Entenmann Veterans Law Clinic. The clinic focuses on VA benefits cases and discharge upgrade for low-income veterans. And my background is in working with sexual assault survivors, and particularly those who were assaulted in the military, with their claims and with providing trauma-informed legal services. Thank you so much for being here today, where we're going to be talking about the unique experiences of minority veterans that lead to disproportionate justice system involvement, as well as the ways in which trauma, both military and beyond, manifest in behaviors that are inherently criminalized without fully understanding the complexity of the circumstances around the situations. And as a bit of background, it's important to understand the ways in which minority service members face marginalization, discrimination, and disproportionate punishment while in the military. A 2017 report by the organization Protect Our Defenders found that Black service members were more likely than white service members to have disciplinary action taken them in a given year. To break that down by branch, in the Air Force, Black airmen are 71% more likely to face court-martial or non-judicial punishment than white airmen. In the Marines, Black Marines are 30% more likely to receive a guilty finding at a court-martial or non-judicial punishment proceeding than white Marines. Black sailors in the Navy are 40% more likely than white sailors to be referred to special or general court-martial. And in the Army, Black soldiers are on average 61% more likely to face a special or general court-martial compared to white service members. Additionally, between the end of World War II and the repeal of Don't Ask, Don't Tell, over 100,000 service members were discharged with bad paper or less than honorable discharges because of their actual or perceived LGBTQ status. Thousands of LGBTQ service members were discharged with bad paper for behaviors that stemmed from the trauma of having to conceal their sexual or gender or identity, or were discharged for pretextual reasons such as minor misconduct, when the true cause of the discharge was discrimination against them due to their LGBTQ status. The Government Accountability Office found in 2017 that of the service members discharged for misconduct from 2011 to 2015, 62% had been diagnosed with a mental health condition in the last 2 years. Of those, 23%, or almost 1 in 4, received an other than honorable discharge upon leaving the military. Lastly, service members who report sexual harassment and sexual assault are subjected to higher rates of administrative action, which impacts their discharge status, indicating a pattern of retaliation against MST survivors in the military. Unfortunately, current VA regulations repeatedly lead to these same veterans being deemed dishonorable for VA purposes, a term that means veterans with bad paper discharges are often unable to access VA healthcare or benefits. The VA's exclusion of veterans with less than honorable discharges has significant consequences on those veterans and on society. Without the resources and services available from the VA, they experience higher rates of homelessness, mental health crises, substance abuse, and incarceration. According to Bureau of Justice statistics from 2016, roughly 25% of male veterans in state and federal prison received bad paper discharges. Additionally, in both state and federal prisons, about a quarter of male veterans were Black and a tenth were Hispanic. Federal and state governments have taken steps to reduce the number of veterans who are incarcerated. The VA created veteran justice outreach programs with staff who provide case management and other supportive services to veterans to help them avoid unnecessary incarceration. However, the VJO program is limited to VA eligible veterans, which excludes most veterans with bad paper discharges. States and counties have established veterans treatment courts and other diversionary programs to rehabilitate rather than incarcerate veterans facing the justice system. Yet those courts often rely heavily on VA health services to complement their efforts and are therefore hindered in their mission because of the significant percentage of these veterans who have been deemed ineligible for VA. Indeed, 1/3 of veterans treatment courts nationwide do not allow veterans who are not VA eligible to participate in their programs. When minority veterans encounter the criminal justice system, many negative consequences can happen as services are not tailored to meet their unique needs. Given this, tailored solutions are necessary to mitigate justice involvement for minority veterans. Today, we're going to talk about the work that's currently being done by some amazing individuals and organizations to help justice-involved minority veterans, but also about the work that remains to be done and changes our panelists believe would help improve the situation. I'm so grateful to be joined by our amazing panelists to kick off this conversation. And to start with, we have Matt Stimel. Matt is the National Training Director for the Veterans Justice Programs, or VJP. In his role, he is responsible for developing and sustaining the education and training of over 400 VJP field staff, contributing to national VA policy on justice-involved veterans, and cultivating operational partnerships, both internal and external to VA, to advance VJP's mission of ensuring access and care to justice-involved veterans and reducing risk of recidivism and homelessness in this population. We also have with us Chuck Tyler, who is a disabled U.S. Army veteran and decorated combat veteran who served his country for over a decade. His professional background includes serving as a leader, mentor, coach, and business consultant. In addition to his diverse background, he has more than 2 decades of experience with political campaigns and governmental affairs and is an author and publisher. And lastly, we have Carolyn Hardin, who is the Chief of Training and Research for the National Association of Drug Court Professionals, a non-governmental organization based in Washington, D.C. She oversees the daily operations for NADCP's 3 divisions: National Drug Court Institute, National Center for DWI Courts, and Justice for Vets. She also oversees the development and implementation of training for the organization. Ms. Hardin currently travels nationally and internationally, assisting teams with planning and operating successful drug courts. Thank you all for being here today. So I'm going to start off with a question for all 3 of you, which is, each of you are involved in this very important work of working with justice-involved veterans. Can you share a bit about how you got involved and the work you do? And we'll start with Chuck.
Thank you so much, Samantha, for having me here. I'm going to have to go all the way back to 1993 after a few deployments, and I was at Fort Campbell, was wondering why I was drinking so much and didn't understand the parameters of PTSD, when a couple other soldiers had the exact same experience that I did. However, I was processed out of the military with a BCD, and that was later upgraded through a lot of hard work on my behalf and others. But a couple of the other white veterans who were drinking as much, if not more than me, were ordered to go to the dispensary, pick up some Antabase, and had mandatory formations every day to take the pill that would make them throw up if they drank alcohol. So from 1993, I saw that there was a huge disparity between how certain active duty members of the military were treated, and that carried on into my veteran life. So from there, I wanted to be involved in things that would address that directly. So I really appreciate being here.
Thank you. And next, Matt.
Yeah, thank you so much for having me. I really appreciate MVA putting this together for us to be together, and really glad to be with you, Chuck and Carolyn. So there's sort of 2 different paths that led me here, and a sort of personal and professional one. I'll start with the professional, and maybe later we'll get back to the personal. But I actually specialized in forensic psychology in graduate school, and always had an interest in psycholegal issues and correctional mental health, and also had a strong interest in understanding trauma, because you can't spend any time working in criminal justice settings and not be aware of the prevalence of PTSD and trauma and the social fabric disruptions that occur in people's lives, both that lead them to the system, but also continue to be perpetuated by their involvement with the system. And then you also can't spend any time treating trauma and thinking about PTSD without thinking about veterans, especially if you were training and learning post the start of the Iraq and Afghanistan wars, as I was. And once you start to work with veterans, you realize that regardless of their era and regardless whether or not they served in combat, there are many elements of service that can lead to contact with law enforcement and subsequent involvement in the justice system. My father was also Navy, and so serving veterans was really important to me. And I didn't know if I'd ever be able to merge these two interests in terms of trauma and justice involvement, but I got very lucky in coming to work at the VA out here in Palo Alto in Northern California and learned about veterans justice programs, which I had never heard of. Then got even luckier because the predecessor of my job, Dr. Joel Rosenthal, who's an incredible mentor and force in this space, which I know Carolyn can attest to, sort of taught me a little bit about what was going on. And so I hit the ground running actually as a frontline VJO specialist myself, covering 5 different counties in and around Northern California and the Bay Area, working with 7 different treatment courts, a couple of which I helped establish, doing outreach in 7 different county jail facilities. And then 2 years ago, got even luckier to be promoted to the job I'm in now. So I was able to sort of translate my passion of doing everything I could to support justice on all veterans into supporting our staff who serve those veterans every day, and just really proud of all the work that they do every day. It's incredible stuff. And I'm very lucky to be able to serve them and help them serve the veterans that we work with.
That's great. And Carolyn, what about you?
Well, thank you guys for allowing me to be here today with the other panelists and to participate in this opportunity. For me, I have been with the National Association of Drug Court Professionals for 20 years. And in 2008, when Judge Russell started the very first Veterans Treatment Court, when they started, they invited us down to check it out and say, we're doing this new and unique thing with veterans who experience different things than we see from some of the other folks who come in the criminal justice system with PTSD, some of the substance use disorders. So we went and checked it out, and it was amazing to watch. That was very different from what we've seen in the other programs that we had run. And one of the things that we saw was the camaraderie, the coming together for the veterans and how they interact with each other. So it was a great opportunity. Similar to Matthew, I grew up in a very military family. Out of my mother's kids, there's only 2 of us who did not serve in any branch, and considering all my other family members as well. So it was nice to be able to combine something that I'd seen growing up over the years, especially with trauma, and especially in the Black community, of how to bring those things together in the criminal justice system, which I have been working in. So that's why I'm here and glad to be here.
So I'm going to follow up with what you were just saying, Carolyn, particularly given the points you were making about veterans treatment courts, which have this ability to be highly effective tools at mitigating incarceration for justice-involved veterans, and instead providing these tools and resources to address underlying mental health and substance abuse issues. Given the higher propensity for minority veterans to face justice involvement, how are and how can veterans treatment courts to be tailored to serve the unique needs of minority veterans? And what do you see as current gaps or shortfalls in the way they are functioning today?
Well, thank you for that. One of the things that I get the pleasure of overseeing the training and technical assistance that we provide from veteran treatment courts. And so one of the things that we're able to help them really look at is their target population, who's getting in and who does not get into their programs. One of the great things that we see across the board is that, as you just gave out some great data on minority populations and what happens to them, we see a higher propensity from BIPOC populations in the criminal justice system. And so one of the things that we really try to talk about is taking in violent offenders. You often see minorities get more violent cases than they actually than others, shall we say. And so being able to serve that population does help. The other thing that we see is that there is a cultural component that goes beyond just being a veteran. So not just addressing the military culture, but other cultural components of understanding what's going on with that population, what's important to them, and the communities in which they live in. And so one of the gaps that we see is that veteran treatment courts, we train them to start developing advisory boards so that they have a community advisory board that is representative of the underserved populations in their community. The other thing is that in veteran treatment courts, they have mentors. Well, if you don't have mentors that are BIPOC that represent those that you're trying to get into your program, that is a problem. But if you also have an advisory board that looks at those minority communities, it will bring in more folks because they see people that look like them that says, oh, this is a program that I also might want to try. And there are ways to do that. It's recruiting, but recruitment in different areas, right? So you might want to reach out to your sororities, fraternities. You may want to reach out to historical Black institutions. You may want to reach out to different communities that some treatment courts have not traditionally reached out to look at those underserved populations where there may be a high number of minorities that they can have access to. And the other thing is finding and looking for younger mentors to be a part of the process. And so that includes our outreach to a lot of colleges and universities that have now veteran service departments, right? So it's a way to do some of those things, to do some more engagement with different populations. So I think that's one of the lacking things that we see in treatment courts that we hope we will see change over the next couple of years.
Yeah, that makes a lot of sense. I in a lot of my conversations with those in the New York area, working in veterans treatment courts, I've heard about sort of the dearth of mentors when it comes to women veterans, LGBTQ veterans. I know it's also true for veterans in the BIPOC community. And so I know that this is something that they've really been trying to increase the number of mentors who can have that connection with their mentees. And so moving on to Chuck, let's talk about the impact of justice involvement. Starting with service and leading into civilian society, how do minority veterans, minority service members and veterans experience the justice system differently than their peers?
I appreciate that question, Samantha. And if I could just continue the thread that I started in 1993, I'm going to pull that thread briefly to 2018, when I received a letter from the VA saying that, Mr. Tyler, in 2013, we show that you were on a fugitive warrant. So you have 30 days to show us that, whatever circumstances were involved, or we'll just take your disability. And at that time, I'm receiving 30% disability. And so I produced the ask for paperwork, sent it in, and was told that it wasn't enough. Can I try again? Tried again. And the final decision was, well, Mr. Tyler, we don't know when you may not have been on this warrant. So we're going to take everything from 2013 when we see it until 2018, because you haven't proven to us, to our satisfaction, that that warrant was settled. I said, okay, great. It has taken me now 3 years and an attorney who really believes in justice to finally get the VA to listen. The administration changed. There may have been a different set of ears now listening. But what I want to credit, are the hardworking people out in the field who understand that there are disparities, who recognize those disparities and who will address them directly. Any other circumstance, and these are words of my attorney. My attorney was telling me, listen, the paperwork we sent in at the very beginning should have solved everything. So we're unclear why they continue to push, and then finally decide against you and created this $21,000 debt that, will soon be eradicated based on the new evidence and the new set of ears that are listening to our case. So I say all that to say, yes, it's frustrating. It's very easy to look at the monolith that is the Veterans Administration, that is the U.S. government, and to sit down and say, I don't know what to do. But, all of us have gone through basic training. All of us have gone through advanced training. I know in the Army, we we're taught the three tenets of shoot, communicate, and move. And so that's all I know what to do. And I carry that into, my civilian advocacy. So I really appreciate the question. Thank you, Samantha. You're still on mute. It's okay.
You'd think a year and a half into all this, 2 years into this, we'd remember to unmute ourselves. But I think you raise a really important point about not just the impact of the justice system itself on veterans, but this impacts your benefits. This can cause these tremendous overpayments. This can cause these really big cascading consequences that often don't get enough attention. And picking up on that, I'm wondering if, Matt, you can talk about what work is the VA doing to support justice-involved veterans? What solutions are being built that are tailored to address the unique lived experiences and needs of minority veterans in particular?
Yeah, sure. So you mentioned veterans justice programs, and we have two programs. The first, Veterans Justice Outreach, which interacts with the front end of the criminal justice system, working in courts and jails, and even further upstream with crisis intervention and law enforcement deflection teams. We have almost 400 specialists doing that job, at least one in every VA medical center. We're in over 1,800 county jails and work with over 600 treatment courts, including tribal courts and in indigenous communities. And then our other program, Healthcare for Reentry Veterans, interacts with the back end of the system, working with veterans in state and federal prisons and focusing on reintegration and reentry into the community. We have 44 staff doing that nationally, and we're now reached over 1,000 prisons. Combined, we saw actually almost 40,000 unique veterans in 2021. So that's the justice programs. But in terms of broadly, in terms of serving minority veterans specifically, I could spend a whole panel talking about each of the things I'm about to discuss, but only have a couple of minutes. So I also just want to say, please, anyone in the audience, feel free to follow up with me directly and happy to talk more about this. It's really important to note that VJP sits at the crossroads of multiple systems, which gives us a pretty unique, expansive sphere of influence, but also not very much direct power in any one of those systems. We're a small program at the VA, and we're guests in the criminal justice system. So the challenge for us is to leverage our expertise in a way that helps bring those systems along. Chuck, you mentioned the Fugitive Felon program. That is something that is a constant challenge for our specialists in working with the veterans we serve. And that's one of those examples of, we don't control that program, but really trying to work with them to educate them on some of the issues that you're raising that comes up for a lot of veterans that we work with in the justice system. So internally to VJP, the first thing we did was disaggregate all our data on the effectiveness of our program to link veterans we see to care at the VA. And we're pleased that in seeing that, we're seeing that there's no differences in terms of minority veterans versus white veterans getting access to care once we see them. And we plan to continue disaggregating all the data we look at. But that said, we know that doesn't capture the whole story of veterans' experiences because we don't know who we're not seeing. And to Carolyn's point about the restricted access to treatment courts, we know that treatment courts of all stripes have to come to terms with these disparities in access. And so we're trying to continually provide training and resources to our staff on issues of inequity, racial trauma, the kinds of things that lead to those disparities so that they can work with their court partners on utilizing tools like the Equity and Inclusion Toolkit that NADC developed and sort of help their court partners along in this process. Secondly, along those lines of not knowing who we don't see, we're prioritizing training and education on outreach to veterans who are not yet enrolled in VA services, in particular those with other than honorable discharges. Since, as we talked about, we know bad paper disproportionately impacts minority veterans, which then disproportionately impacts their access to care. And VA has done some expansion of eligibility for veterans with OTH. And so we're really trying to get the word out to those veterans and our justice partners on that expanded care and ensure that we're seeing these veterans in jails and courts who maybe previously thought they weren't eligible for services. Third, even within VA, of course, we have our own blind spots, even working in this field and really passionately in this field, we have our own blind spots. So we established a VJP-specific Racial Equity and Justice Council, which is led by our staff and provides advisory feedback to our program office, including suggestions for research, discussing ongoing program objectives, and perhaps most importantly, holding listening sessions for our staff on their experiences, whether they're staff of color or they're white staff, on their experiences working in the justice system and the experience of the veterans they're serving who may be experiencing disparities and discrimination in those systems. And we're also part of Homeless Program's broader effort around Racial Equity Improvement Initiative, which my colleague's talking about tomorrow. really quickly, I know I'm over time. Fourth, lived experience matters. This year, we're actually funding peer support specialists to be specifically tied to our programs so that when we go out into courts and jails, we're going with people who have lived experience. And fifth, we're also really focusing on stigma and how stigma shows up in this population and veterans' experiences, not just in the justice system, but how stigmatization of justice involvement impacts their course through the VA. So I'll stop there. Thanks.
It's a good sign that you're running out of time because of all of the things that are being done in this area, right? You know, we want there to be so many that you don't have enough time to address them. I think one of the things that you mentioned briefly that is so often a problem here is just fundamentally getting the word out, right? Making sure that veterans know about services that are available, especially when there are these expansions. You sometimes have groups that have been historically denied access or denied eligibility who now may have things change for them and don't know that and don't try or are scared to try because of their past experiences. So I have another question for all of you here, but I'm going to start with Carolyn. Given that the law treats identity categories as discrete, and many have in fact criticized the law's colorblind approach to racism, what do you see as the best way to support justice-involved veterans who are living at the intersection of multiple marginalized identities?
Well, I think one thing, Matt kind of mentioned it earlier, is we created an equity and inclusion toolkit, which we use to train all of the different types of treatment courts. But one of the things that we've seen over the past year or two is that we've been able to teach it to judicial colleges, judicial training. So to really get out there and help educate folks more about what we mean when we say don't be colorblind, and how that can marginalize different folks who are coming through the system because you don't see them, therefore you may be discounting their needs. So that is a big thing. But I also think one of the best ways to support that is by really helping justice-involved veterans have a voice. To speak up, to talk about, I am here, I do have other needs. And that sometimes can be a very challenging proposition for those of us who work with them because they are used to speaking up and not being heard. So then really having people in place that can listen, that take what they're saying and then don't just do what they think is best for them, but figure out what really is best for them, to hear where they are, sort of like doing motivational interviewing when they walk in the door and saying, I'll meet you where you are, and how do we move forward to do that? So those are things that I think can be very beneficial.
Yeah, Chuck, I'm going to go to you on this same question. What do you see as sort of the best way for us to support, for the law to support justice-involved veterans who are dealing with multiple marginalized identities?
I really appreciate what Carolyn was saying, and I would want to expand on that because I've had the experience of watching a judge sentence a veteran to a rather harsh sentence. And when the veteran said, well, is this how we treat veterans in this courtroom? He was thrown out, and the judge took umbrage because he said in open court, we respect and honor our veterans, so I don't know what he's talking about. Of course, the veteran was Black, and the judge didn't quite understand the irony of his statement. So I really applaud the efforts that Carolyn just outlined, allowing these jurists and others who touch veterans in the justice system to understand where their biases lie and how they impact their sentencing. When we can look to one type of veteran and say, you know, because of your service, we really thank you. We want to get you the help you need, versus we don't really care if you served your country. What we see is a felon, and so that's how we're going to treat you. These things need to change, and I think efforts like Carolyn's and Matthew's are really advancing that agenda. So I really appreciate what they're doing.
Yeah. And Matt, anything to add here?
Yeah, the thing, obviously I've really been passionate about this work for a long time, but what really sort of got me into thinking about the inequities in the system around helping veterans in the justice system was a very similar experience to what Chuck just shared. In the parent court, so before being referred to a treatment court, I was working with two different veterans. One, a white veteran who is 100% service connected for PTSD, who had a very serious, very violent domestic violence charge, and he actually got referred to Veterans Treatment Court. And another Black veteran who's 100% connected, service connected for schizophrenia, who made a threatening statement but did not actually hurt anyone, and sort of just ran away and then got picked up, sent to 4 years in prison. And it was such a stark contrast in treatment, and so heartbreaking to see and to feel so powerless. And so when I was thinking about this question, I was thinking about it both from the individual level and the systems level. So at the individual level, to sort of what Chuck and Carolyn are talking about, there's the importance of really making sure that veterans living at this intersection feel seen and recognized, and to validate their experiences in these multiple systems in which we interact with them, which includes not just the justice system, but also the VA. I've worked with plenty of veterans who clearly experienced discrimination in both. And so instead of trying to explain it away, it's really important to listen, and then where we have influence, to help empower them to get the support they need. And then in terms of the systems, we need to take those stories, those experiences and anecdotes, and I think merge them with data, what Carolyn was talking about with the Equity and Inclusion Toolkit, to show that we need change from those higher levels. NACP really does an amazing job of this. Their conference last year, this was a constant theme of we need to be looking at it and understanding this, because it's easy to say you're colorblind in spirit and with this intentionality. But if you're looking at numbers that show that's quite the opposite, you can't really maintain that position. And I think data is really important in order to do that, and really encouraging these systems to look at who's getting into the courts and how are they doing once they're in the courts is really important. And then lastly, identification, right? How we're identifying veterans in these systems. VA developed a couple of tools to help with identification that pulls on just objective national data sets. But most systems, most courts and jails and prisons still just ask the question, if you ever served or are you a veteran? And there are so many reasons why both the person responding to that question as well as the person asking it influence what that response is and who gets identified and who gets referred to VJP for services, et cetera. And so sort of increasing tools that can help identify veterans across the system is really important. And lastly, I'll just say that's why we're so big on stigma and understanding stigmatization across these different spectrums, because let's say everything works out and we get veterans into treatment and they're getting care at the VA, having justice involvement in their background, having to deal with things like the Fugitive Felon panel, having to report to probation or parole, all of those things can be shorthand ways that providers unintentionally sort of makes assumptions and judgments about the veteran that they're working with. And so really trying to understand veterans' experiences once they get into treatment and how stigmatization around their multiple identities influences their care is also vital. And so it's something that we can't really lose focus of.
Yeah, I think you've all in this answer really pulled it at so many things that are really going on. I mean, first of all, I think partially due to the fairly growing civilian versus military divide in our society and lack of understanding by those who haven't served of those who serve. You do have, I mean, you have some departments that aren't, police departments and things like that, that aren't asking about veteran status at all. When people are coming into the justice system, then they are asking the question, are you a veteran? And not understanding the notion that that's not necessarily going to lead to a full swath of who actually is a veteran in front of you. The very notion that are you a veteran can be a loaded question in a lot of ways is not widely understood. And then you have all of this intersection of issues around race, issues around mental health, sexual orientation, gender identity, all of which are areas in which so much more work needs to be done. And so you really do have sort of this nexus of just all of these really complicated issues where there is a lot of work to be done. And I'm very glad that we have folks like the three of you who are working on these issues. Chuck, I'm wondering if you can talk, I know you've already talked about this a bit today, but what was your calling to move from your military career into dedicating your career on focusing around this issue and supporting justice-involved veterans?
I really appreciate that question, Samantha, because in 2003, coming back from Iraq, I was really tired of getting shot at. So I thought I would get into political campaign work to help elect smarter people to public office. I'm a huge believer in soft power and how we don't always have to throw the military out there to solve all of our foreign policy problems. But on an individual level, I was convicted of a felony for failure to pay child support. And although people, will kind of be like, well, that's weird. Some states take it very seriously. And the stigma of having the felony label really at times, and Matthew and Carolyn, alluded to this, it has a greater weight than, oh, you served your country. So from there, interacting with the justice system, I wanted to be part of the change. I got a paralegal certificate and am now pursuing options to go to law school through my Chapter 31 benefits, because I think I would bring that empathy into that space, if that makes sense. I've had the lived experiences that I know a lot of other justice involved veterans would share, and so I want to be that person that has that empathy and understands, exactly what they're feeling. Just to close, I was on a Facebook post, or I was on a Facebook page where someone posted, the situations are so deplorable in this particular jail, I don't want to go. And I'm an attorney and I just don't like going there. And I don't ever want to post something like that. Once I, get into law, once I'm representing veterans who are involved in the justice system, I never want to do that because I know what it's like to be on the other side. And I know that, folks like Matthew, yourself, Carolyn, are the ones in Minority Veterans of America as a whole, provide beacons of hope for justice involved veterans like myself. So thank you for that question.
Yeah, absolutely. And from a lawyer who very much values the importance of trauma-informed legal services and individuals who understand what those they serve have been through. I wish you the best of luck in that career move, because I think it's a wonderful thing. Matt, well, Carolyn and Matt, as folks who didn't serve in the military, you talked a little bit about family members who served and things like that, but what was your calling to focus your careers on supporting justice-involved veterans? What made you want to sort of devote your life work to this? And I'll start with you, Matt.
Sure. So I did mention my father, which is true, and that really helped. And actually, both my parents worked in healthcare and in community health settings, and so just the idea of service was important, generally speaking. My brother's a public school teacher. I do this, and so that's really meaningful. But we also talked a lot about lived experience and how that can influence what we do and what we understand about what's going on. And I actually have an older cousin who spent a significant amount of time in prison, and it was actually through visiting him in my early 20s that I sort of came to understand what life in carceral settings were like, from his perspective, and also from meeting people that he was close with there, as well as just hearing their stories. So when I was in grad school, the first clinical placement I took was actually at a mental health clinic in Rikers Island, which Samantha, I'm sure you're very familiar with, but for those on the call might not be, is a huge jail complex in New York City with pretty horrific conditions across the board. Certainly this was 2006, so even worse then. But it's really there that I got the foundational training and exposure to so much of what guides me and what I do today. And so when I saw the opportunity to help veterans in these spaces, it was clear how important the mission would be. And then when you have experiences, like I mentioned, in terms of seeing what you see in disparities in courts and how veterans are treated, even experiences they might experience at the VA. And then more importantly, when you meet like-minded people like Carolyn and like Chuck, and see their passion and commitment, and importantly, how many veterans continue to sign up to help. Right? When you work with veteran mentor teams in courts, a lot of our staff in VJO are veterans, not the peer support specialists, but actual VJO specialists themselves are veterans who became social workers to help out other veterans in need, and how important that mantra of leaving no veteran behind is so powerful. It's impossible not to just continue the fight and do everything you can to assist. And so it's really just a sort of confluence of all those things that inspire me and keep me going. So really proud to be a part of it.
Carolyn?
Well, thanks. This is a question that I pondered as I was looking at them. Yes, I come from a veteran heavily family, not just my siblings, but relatives. And similar to Matt, I've had experience with different relatives being in the justice system and how it impacted not just them, but the family. And so one of the reasons in this work that I have dedicated to doing is really helping folks to understand the language that we use is powerful. We can say things that can demoralize individuals who are coming through an already traumatic experience, right? So there's something else that's happening, and now I found myself in the criminal justice system, and there were these other problems that impacted. I think that there is an opportunity in the work that we do to have public safety and public health come together and unite and meet and have a discussion that requires them to openly talk. When we start to address substance use and mental health issues really as public health, as a health disorder, as opposed to always criminalizing different things, we will be able to have better outcomes. And so I think I get to play, I'm excited that I've been given the opportunity to play a role in helping to educate those who work with folks in the justice field about how language is important and what we do is more important than what we say at times, that we really have to bring what we do and what we say together to give people a positive experience who come through our system. We have to treat it like it's the Mayo Clinic. When you come in, we assess you and we figure out which aisles to send you down. And for some folks, it means multiple aisles, and sometimes it means coming back multiple times. But we have to be there to open the doors for them and to help them have, to sometimes help them get through. Some people aren't able to walk through that door, but they're to be able to find the right people to hold their hand to get them through the door so that they can get in a chance to be able to experience something differently. So I'm grateful for this opportunity.
Yeah, as I was asking this question, I was sort of chuckling to myself because every time I am on a panel as someone who did not serve in the military, I'm often asked, what brought you to want to serve veterans? And it's always seemed in a way like a silly question in the sense that, in very few other areas are we surprised by those who may not have the exact lived experience choosing to help, right? We don't look at folks necessarily in the immigration space and wonder why they got involved. We don't look at folks who are doing domestic violence work who may not have lived through domestic violence and wonder why are they doing this work. It's really unique with veterans. And I think it really comes from this very large civilian military divide and this real need that veterans have felt, rightfully so, to be the ones fighting for other veterans, because there have not been many who have not served who are going to step up in that way. And so for me, I feel like the question almost answers itself of why work with veterans. And it is a way for those of us who didn't serve to give back to those who risk so much and sacrifice so much for us. And so I'm interested in the answer every time, but I'm also, surprised by the question's existence in some ways. You all were so good about keeping to time that we actually have a little bit of time. And so I wanted to throw a question at you here at the end of just, if you had one wish overnight, you could change one thing about the current system when it comes to justice-involved minority veterans, what would be that thing that you would change with your magic wand? And I am going to put Matt on the spot and start with him. Matt, you're on mute.
Yeah, you didn't hear me laugh in nervousness. So this is expressly my opinion as an individual, but I think I mentioned expanded eligibility earlier, and it's great that that's happening. I think there should be a more universal response to that experience rather than kind of incrementally kind of building that out, because I think that would just kind of give everyone, they shouldn't need the permission to build their awareness of this stuff and bring people in or have some courts that allow eligible veterans and some are ineligible veterans and others that don't. All of those things would just make it so much easier just to bring everyone into the fold and into care and not have to worry about all of the administrative and bureaucratic stuff that Chuck was talking about going through that comes with these kind of different eligibility determinations. So I think that's what would be most useful.
Chuck, I'm actually going to change the question slightly because we got a question in our Q&A and I think it'd be interesting to hear your response to it. Someone asked, can you share some tips about how to have sensitive and delicate conversations with individuals who are justice involved veterans, especially if you're trying to help them when it comes to issues regarding employment, where their justice involved history may come up as part of the conversation?
Certainly, I really appreciate that question. I really want to focus so much on listening as being the basis of the conversation. I, for one, have had the experience of when I received that felony for failure to pay child support. I had to serve 2 years in the state prison, and you are overwhelmed by how many of people who've been incarcerated aren't heard. So they tattoo themselves, they listen to loud music, they do these things to be seen and to be heard in that particular environment. But one of the things I was so blessed at being able to do was to sit down one-on-one with a lot of them and to just listen. Just listen. You'll get the BS story, the street story of, how I got here and everything like that. But if you continue to listen, then you continue to plumb through the depths of the surface. And they really start to share with you their hopes, their fears. And I think when we start to listen to those folks, Samantha, then we're able to tailor what they really need. We can meet them at their need. We can make a lot of assumptions, but until we start listening, then and only then do I think we can just completely address that person as a person. And I think that's what really everyone really ultimately wants in the end. So I really appreciate that question. I don't think I felt like I answered it, but the short answer would be, please listen first. Please listen first. Listen without judgment, listen without fear, and listen with a sense of, I'm probably not going to have any shared experiences with this person other than these moments that he's sharing or she's sharing with me. So just allow that to develop into the foundation of what type of services you want to provide from that point on.
Yeah, I'm also going to add that I think that the very fact that you're asking the question to the question asker is a good start in the right direction. It means you're thinking in the right headspace. It means that you're realizing that there is a required level of sensitivity and compassion, and it means you do want to hear. And I think that the more you show that you are listening because you actually care and you want to help, the more you will be trusted and you will be able to have continuing conversations, and you will hopefully make that person feel as if the next time someone asks them questions, they also can feel comfortable talking more and more. We are almost out of time. So Carolyn, you might get saved from the magic wand question unless you think you can answer it in a quick 1-minute answer. No, okay, great. You're getting saved. Sorry, Matt, you were the only one who had that tough one. But I wanted to say thank you to all of our panelists and to those of you who are here with us today to just hit the tip of the iceberg on what is such a bigger conversation. I hope it inspires you to keep this issue in mind more than just for this brief conversation, and something you continue to think about and think towards. I'm so grateful for Minority Veterans of America's work on this issue and their ability to bring us all together to have these really important conversations. I believe that next up there is a panel regarding gender as a framework for military and veteran identity. So I hope folks stay tuned to listen to that next panel. And thank you so much for being with us today. Thank you again to Carolyn, Chuck, and Matt for not only being here with us today, but also for being so candid in your responses and thinking so deeply through these really important issues.
Thanks all. Take care.
Thanks, everyone.